This video demonstrates a brief counseling role-play session as part of the PY 7194 Treatment Interventions module. The purpose of this session is to explore a client's concerns and to practice core counseling skills such as listening, empathy, and reflection. Hello, Sarah. My name is Olagoke. Thank you for coming today. Before we begin, I want to explain confidentiality. What you share here will remain private unless I become concerned about your safety or someone else's safety. We have about 10 minutes together today. Does that feel okay for you? Are you happy to continue?
Yes, that's fine.
Thank you. What would you like to talk about today?
I've been feeling really overwhelmed recently, especially with university work and expectations from my family.
Sounds like you're dealing with quite a lot of pressure at the moment.
University has been stressful, and my family expects a lot from me.
So, from what you've shared, the pressure from university and family expectations seems to be causing a lot of stress and anxiety.
Yes, it feels like too much sometimes.
Can you tell me a little more about what has been most difficult for you?
University workload, challenges with change of environment, language, and new culture. Sometimes I just want everything to stop.
Thank you for sharing that. When you say everything to stop, what does that mean for you?
I don't mean I want to harm myself. I just want the pressure to go away.
Have you had any thoughts about harming yourself?
No, nothing like that.
We are coming towards the end of our time today. We talked about the pressure from university and family expectations. How are you feeling now compared with when we started?
I feel a bit lighter and less exhausted, and I think talking about it really helped.
Thank you for sharing your experience today. Before finishing this demonstration, it is useful to briefly highlight what assessors typically look for in counseling role-play assessments. Markers are generally less concerned with solving the client's problem and more interested in how effectively the student demonstrates core counseling skills. These include empathy, active listening, emotional awareness, and the ability to explore a client's experiences in a respectful and supportive way. Students are expected to begin the session in a professional manner by introducing themselves, explaining their role, clarifying confidentiality, and ensuring the client feels comfortable continuing with the conversation. As the session progresses, assessors look for the ability to build rapport with the client. This is often demonstrated through attentive listening, appropriate eye contact, open body language, and the use of open-ended questions that encourage the client to speak about their thoughts and feelings. Another important skill is reflective listening. Counselors should show that they understand what the client is saying by paraphrasing key points, reflecting emotions, and occasionally summarizing what has been shared during the conversation. Students are also expected to remain calm, respectful, and non-judgmental throughout the session while being aware of ethical responsibilities. This includes recognizing potential signs of distress or risk and responding in an appropriate and sensitive manner. Some common mistakes in counseling role plays include asking too many rapid questions, interrupting the client, giving advice too quickly, or trying to fix the problem rather than allowing the client space to explore their experiences. The primary aim of counseling is not to provide immediate solutions, but to create a safe environment where clients feel heard, understood, and supported as they reflect on their own situation